Oi, tudo bem? Mais um dia. Hoje nós vamos a continuar com interpretante médica simultânea com cenário real de médico.
Hi, I'm PJ Daniels.
Oi,
Sorry, let me
eu
wash my
sou
hands.
PJ Daniels.
Just call me
Vou
Dorothy.
lavar
Oh,
meus
thank you. That's the
mãos.
next thing I was
Por
going to
favor, me
ask you.
chama,
So, Dorothy,
Dorothy.
the nurse mentioned to me that you wanted to talk about your
Uma
care.
enfermeira
What's
me
going
ensinou
on?
para mim.
5 days ago,
Para
I
mim,
was
diz
admitted to
você que fala
emergency,
sobre
and
seu
they
serviço
treated
de
me
cuidado.
by putting
5
this
dias
tube down my
atrás,
throat.
eles
And I tried
levaram
to
eu a
tell them and
emergência.
gesture them that I don't want
E
this
eles
tube down my
foram me
throat.
tratado pelo esse
And I
tubo
just hope that never
de
happens again.
respiração. Eles
Okay.
colocaram
No, I
através
totally
minha
understand that. I mean, that is
garganta.
quite a scary thing
Mas
to
eu
go through.
tentei falar com
And
eles, eu não
I think we
quero
do need to
esse
talk about this more, and I'm glad that
tubo,
you've asked
mas
to
eles
talk to me
não
about this.
entendem.
So I had a little bit of a
Tudo
look
bem,
through your
eu
chart, so I think
entendi.
I understand
Vou
why they
dizer,
did it, but
você
did anybody explain
está
it to you?
assustado com isso.
Well,
Mas
not really.
eu vou entender.
And because I
eu olhei
was
seu chat, eu vi.
gasping
Mas
for
eles
air
explicar
in
para
the
você
state I
por que
was,
eles
but
fazem isso.
I'll tell you
Sim,
what,
para ser,
I'm
é
really
porque
worried
eu
about that tube anymore. This won't
eu estou
happen to me
afando
again.
para mas
I
vou falar
don't
com
want that
você.
tube anymore.
Eu estou preocupando porque eu não quero essa
I'm
coisa
okay
acontecer mais.
to pass as I
Ah,
am.
Absolutely. And
As
you
I
know
am.
what? There's
E não
no
quero
right
ele
answer when it
acontecer
comes
de
to
novo.
deciding on
Eu
things that are
quero mais
I'm
esse
okay
tubo.
to pass as I am.
Eu
Absolutely. And you
As
know
I
what?
bem para passar
There's no
como
right
eu
answer when it comes to deciding on
Absolutamente
things that are aggressive
não
like the
tem
tube.
resposta
We really
certa
want to know what the patient
quando
values in terms of,
paciente
you know,
precisa de
things that are that
tubo.
invasive.
Nós
And so
nós
absolutely
realmente
we'll
querer
respect
saber
whatever it is that you
o que
want.
paciente
But I do need to find out a
Nós
little
vamos
bit more about
respeitar
you in
o que
terms of
paciente quer.
what is your
Mas eu
understanding
quero
of what
saber
brought you into hospital?
o que
Well,
leva
I have
você
congestive
aqui no
heart
hospital.
failure.
Tudo bem,
And
eu tenho
heart failure.
insuficiência
And
cardíaca.
I guess there was
congestiva.
water in my lungs
E
and
parece
stopping me
que
from breathing
água no
properly.
meu,
So
os pulmões
I was living in my,
que
so the
afeta
ambulance
minha
brought me in
respiração.
to the
Então,
emergency.
A ambulância
So
leva eu tô
They, that was
afando
how they were treating me.
So you pretty much showed up to
leva eu ao
emergency
hospital. E
and very
eles estão
quickly they put
usando
that
esse
tube down.
That's
maneira
correct.
Did
para
anybody ask you
tratar
if you were
eu.
okay with that?
Sim, então você sabe,
Well, I
você
tried to
tem
gesture to
a
them that I
emergência,
don't want the
eles
tube,
usam
but
esse tubo para tratamento, mas
They didn't quite pick up on that.
você
I guess
fala
not.
com eles
and you know,
sobre
I've had
esse
that
tubo.
3
Sim,
times
eu
already.
esse tubo
The
três
tube you've
vezes.
had down 3
Yes,
times?
yes.
Oh, wow.
Esse tubo
Yes,
você
I
já
don't
usou
want it
3
anymore.
vezes? Sim,
Okay.
sim.
And
tá.
so you
Não
have
quero
congestive
usar
heart
mais.
failure, and it sounds like you've got a
Então
breathing
você
problem.
tem
Yes.
And do you know why
para
they would
nossa.
have put the tube
Parece
down?
você
Do you know
tem
what they were trying
problema
to
de
do?
respiração. Você
I
sabe
guess
porque eles
because
usam
I
esse
was
tubo
short
para
of
você.
air.
Parece por causa
I
de
had
eu
a
falta
hard
de
time
ar
breathing.
e eu
Right.
tenho dificuldade de
So they
respirar.
tried to,
E ele
I'm gonna
tentar
use the word
ressuscitar
save me.
eu ou salvar eu.
So it sounds like you understand
Então,
that. I mean,
parece
usually we
você
only put a
entender.
tube in if that was the only
Isso.
thing we could do
Tá, nós
to
usamos
save
esse
you. Patient will often give
Esse
if
é
someone is in
medicação.
heart thing we could do to save you. Most of the time with congestive heart failure we'll give some medications. Heart failure will give some medications. Have you heard of Lasix or furosemide?
Você já ouviu Laxis
No.
ou
Okay.
Furosemide?
It's a medication
Não.
we'll often
É
give
medicamento.
if someone is in
Nos-
heart failure. But if someone is
normalmente dá
really sick
paciente
and we don't think we have
com
time to give it,
insuficiência
that's the time we would think
cardíaca.
of a breathing sick,
Sim.
and then we don't think we have time
Esse
to give it.
paciente
That's the
é
time we would
muito
think of a breathing tube.
doente, não tenho
I haven't had a
tempo
chance to
para
look
dar
through the
esse
chart, but
paciente.
it would
Então,
suggest
nós
to me
vamos usar
you were
alternativa
pretty close
de
to dying
tubo
when
de
you came in.
respiração.
If the good Lord says that,
Yeah.
Você é
I,
perto de
I guess
morrer
so.
quando você
But
quando
I'm
eles
okay
levar
with
você
dying.
aqui.
Okay.
you know, like I
Sim, para
says,
ser isso,
I've lived a good
mas eu
life.
tô bem
And if-
para morrer ou faleceu.
If the good Lord says that
Ah.
it's my time, I'm okay with
Se
that.
Deus diz
And
meu tempo,
you wouldn't put a tube down.
eu
No,
tô bem
my
com
throat.
isso.
Already
Você
what
não
I'm
vai
hearing from
colocar
you,
esse
exactly, I'm
tubo
just going to say
na-
exactly what you
a
said. It
minha
sounds like you've
garganta.
lived a good life,
Se
you've been through
eu
this a
entender
few times, you know exactly
você
what it
já vive
involves.
vida mais
And
melhor.
If I could
Então,
paraphrase
você
a
já
few
vive
times, you know exactly what it
vida
involves.
melhor, você já
And
passa esse
if I could
procedimento algumas
paraphrase,
vezes,
to you,
você
quality
sabe
of
que
life is more
que
important than
envolve.
quantity at this
Então, se
stage. Is
posso
that correct?
That is correct.
A qualidade de vida
but
é
you know
mais
what,
melhor
doctor?
que quantidade
How
de
can
vida. É
I
correto? Sim, é correto.
be assured
Como você
that my
eu vou
wishes are
certificar
respected so I don't
minha
get
We're
vida?
talking about,
Boa
absolutely,
pergunta.
I agree with you that
Com coisas
it is
nós
your
estamos
wish, and we will
conversando,
respect that
eu
wish, but
concordar
we're
com
not going to put a
você.
breathing tube
Nós
down
precisamos
again.
respeitar
And then, of course, your second question, which is great as well, is how do we make sure this doesn't happen? So what I'm going to do, so first I did want to answer your previous question. Based on what we're talking about, absolutely, I agree with you that it is your wish, and we will respect that wish, but we're not going to put a breathing tube down again. And then, of course, your second question, which is great as well, is how do we make sure this doesn't happen? So what I'm going to do after our conversation, and I do have a few more questions to ask you, but after our conversation, I write a note documenting what we talked about, that we talked about the breathing tube and your reasons for why you don't want it, which of course makes sense to me. And then what I do is I document a short form called Goals of Care, and I just so it's a really easy way for everyone to look at the form, and in 2 seconds they know exactly what you want. We will give you a copy of that to take home, but I find that's not usually enough. What we also do, what I do, is I tend to, when you leave hospital, dictate a note to your family doctor, and that note's actually available online for anyone who might see you in any emergency department in Alberta. And in that note, it will very clearly state, you and I had this conversation, and you really didn't want the breathing tube. So I'll reassure you, we'll do everything we can to make sure people understand you don't want that tube, okay?
Oh, thank you. I was so concerned about that. And, yes, I think I will rest now because, like I say, that was a horrendous experience, and he says it won't happen again.
I do want to ask you just a few other questions related to this.
Go ahead.
And the first question might sound a little off-putting, but I sort of have to ask it. Anytime someone is changing the kind of therapy they want,
I'm feeling fine. My mood is fine. I have no...
we do have to ask, how is your mood? How are you feeling?
I'm feeling fine. My mood is fine. I have no problems.
Okay, excellent. And how are you feeling overall about life before you came into hospital? Like when you're healthy as you can be, say a few weeks ago.
I think I am enjoying life.
Okay.
Yes, I am enjoying life to the best I can.
Okay, great. And then other related questions. We did talk about the tube that we wouldn't put it in, but again, we want to make sure we know everything that you might want or not want.
Okay.
So if we had to give you medications to get your breathing better, is that something you'd be willing to have?
Certainly.
Okay.
Yes, I'll look at medication, just not the intubation.
Okay. And then usually along the lines with the intubation, when people don't want the intubation, we often also want to know if a nurse were to walk into the room and find just by bad luck you had passed away, or if someone just found you at home, you had passed away, would you ever want people pushing on your chest and giving you shocks, trying to bring you back to life?
No. Like I said, the good Lord knows when it's my time.
No, and that all makes sense to me with the no breathing tube.
Yes, and I have no problems with that.
Okay. There are some other things we can do that's not a breathing tube, but the nurse were to walk into the room and find, just by bad luck, you had passed away, or if someone just found you at home, you had passed away. Would you ever want people pushing on your chest and giving you shocks, trying to bring you back to life?
No. Like I said, the good Lord knows when it's my time.
Yeah. No, and that all makes sense to me with the no breathing tube.
Yes, and I have no problems with that.
Okay. There are some other things we can do that's not a breathing tube, but they're a little aggressive. And one is, have you ever heard of BiPAP?
I don't think so.
It's a mask that really pushes air into you. It's a little uncomfortable, but nothing as bad as a breathing tube. It may be hard to answer this question because you don't know what that is, but do you have any thoughts on that? If you were really sick, if we were to try just a mask, And we would do it just as long as you were just a mask. And we would do it just as long as you were okay with it and comfortable at the time.
Would it be for a long time?
Not usually. Most times with BiPAP, it's only about 2 to 6 hours for most patients.
Yeah, that would be okay with me.
Okay. And if we had to put large IVs and lines into your wrist and stuff and take you to the intensive care unit, again, we wouldn't do breathing tube, but this is just to watch you closely.
Yeah, I would be okay with that.
Okay.
Yes.
Okay.
It doesn't sound invasive to me.
Okay. All right, so let me just summarize. I mean, it sounds like before you came into hospital,
Absolutely.
but we're okay with medicines, we're okay with the mask. Right. So let me just summarize. I mean, it sounds like before you came into hospital, life was pretty good. I mean, it sounds like you've had some rough times with the heart failure.
Yes.
We're very clear we do not want to put the breathing tube down.
Absolutely.
But we're okay with medicines, we're okay with the mask. We wouldn't restart your heart. With medicines, we're okay with the mask. We wouldn't restart your heart. I think that's pretty much everything I think I needed to hear. But is there anything else that you wanted to cover or talk about that I missed?
No, I just needed to be reassured that it won't happen again. And yeah, I know that on my chart it's there.
Yes. Yes.
And that's all I need to hear because I was concerned.
I do want to say that this is not set in stone in the sense that if you ever change your mind, we can have the conversation again. But if we don't hear from you, this is what will go with. No breathing tube, no restarting the heart. I just want you to know that in case anything were to change.
Okay, so if I change my mind, I will talk to you.
Absolutely.
I don't think I'll change my mind.
Okay, I don't think you will either, but it's just nice so that you're aware of that.
Okay.
Honestly, I mean, there's some other questions I tend to ask people when I don't know them well, just kind of routine stuff.
Okay.
And maybe we'll just quickly go through it.
Go ahead.
Your medical history is the heart failure. Anything else?
That's it. Insufficiência cardíaca até outra mais. That's it. Something beginning with an S, but I can't remember what it is.
Okay, that's okay. Usually we have it written down.
Yeah.
Your medications, I think I saw you're on aspirin and digoxin. I think I saw you're on aspirin and digoxin. I think.
Na medicação eu vi você está na aspirina, antidiostina.
Carry this paper with me because I can't remember the names.
Oh, so you are on the water pill, the furosemide.
Okay.
Yes. And then dosizing. Okay, great.
Yeah.
Any allergies?
Você tem alguma alergia?
And I won't ask about anything that runs in your family, given your age. They told me you're 70, is that correct?
That is correct. Okay.
And I do have to ask the following questions completely unrelated to what we're talking about.
That's okay.
Do you smoke at all?
No, I don't.
Do you drink any alcohol? And this will sound crazy, but I have to ask, any street drugs, illegal drugs, anything like that?
No, I never had the opportunity.
I forgot to ask, any over-the-counter herbals in addition to these?
No, I don't take any of those.
And where are you living right now?
I'm